Christine, you're with us today just to try to get a handle on some of these symptoms. I wanted to try to get a feel from you. How long have you been suffering?
About 4 years.
Okay, and what are some of the symptoms that have brought you in to seek out treatment?
Specifically, I do have 24/7 tinnitus. Not the high-pitched tinnitus, but just like a rushing sound. Hearing loss on my left side. I can live with that. I've mostly gotten the violent vertigo episodes under control with diet and supplements, but what has brought me in here today is that it has started to move into my other ear, the tinnitus and the hearing loss occasionally, which is a newer thing, and I've started having drop attacks, which I don't know if you know what
I'm
those
familiar,
are.
yeah. How often do the drop attacks last?
Seconds. You know, I mean, it's just a second and I kind of fall down, or if I'm sitting, my head slumps forward real quick and I have to pick myself back up. And that's a scary thing when I'm thinking about driving, going downstairs. If that were to happen in a number of circumstances, it could be kind of dangerous. So
Sure, absolutely. Have you sought out treatment with other healthcare providers?
I went to an ENT to get the official diagnosis of Meniere's. I did not really want to do their treatment plan. I tend to err on the side of more natural treatments anyway, holistic. So I kind of went my own route. I've worked with several naturopaths who, some thought maybe it was autoimmune, some thought it was viral or bacterial, so we did like ozone therapy, candida, fungal, overgrowth, that kind of thing. We've addressed that through supplements, diet, ozone.
Did you have an MRI to rule out an auditory neuroma?
He didn't,
Okay.
but he was confident, the ENT was confident it was Meniere's, and he felt like because of my age and whatnot, he said he was also mostly confident that it wasn't a neuroma.
Okay. They did a hearing test then?
Yes, I did a hearing test.
Okay, just one?
Yeah.
Okay. What about any stiffness in the neck with rotation or movement?
I just always have stiffness in the neck. Maybe not 24/7, but daily. I'm, rubbing my neck, rubbing my shoulders. It's just
Okay.
kind of always there.
What about in the face?
I don't notice anything in the face.
Okay. Shoulders at all?
Yeah.
Okay. So shoulders and neck?
Yes.
All right. Any sensitivity to sunlight or bright lights?
I would say so, but my husband says it's because I wear my sunglasses too much, so my eyes have gotten used to the sunglasses.
You live in Oregon too, so.
Yeah. But yes, my eyes will water if I take them off. And
Do they weep on the side that has pain or tension? Or have you even noticed?
it's done it once, and that was recently, where
Okay.
again, just coming out, like tearing up. I don't know what induced it, if it was an allergy or what, but that side was draining on that side. Or if I fly in an airplane, maybe not my eye, but my nose will drain on that side, which is super bizarre too.
Okay. And so the left side is the side that's got the hearing affected and the tinnitus?
Correct.
Okay. Any headaches, migraines?
Yeah.
Okay. Where do those normally start, or where
Always
do they
on the left.
Always on the
Always.
left. And you pointed right behind the eye. Is
Yes.
that kind of where it's at?
Yeah.
Nothing from over the head or in the back?
No, so back in the neck is where I'll rub for relief too, but I've never felt anything in the head.
Okay. All right. So you certainly have symptoms that are consistent with craniomandibular dysfunction, and I just wanted to get a feeling for you. There's a lot of ways you could go to treat that, with orthotics, with braces, blah blah blah. What made you decide to do this therapy over others?
It was, for me, important to find somebody who had worked with other people that have Meniere's. I felt like that outweighed everything to have that experience.
Sure.
And so when I would Google TMJ and Meniere's for my hometown, you were the only name that came up, even though you're a couple hours away.
Sure.
So here in our state, there was nobody else that had worked with people with Meniere's that I could find.
There's,
So that's
there's,
a
if you were to walk in, I would venture to say that if you were to walk into any dental office and say, I'm here to have TMD treatment because I was diagnosed with Meniere's, you might get a look like you have two heads.
Yeah.
But this is not a new phenomenon. It's been in the literature since 2008, 2011. Most patients tell me that Meniere's is a diagnosis of exclusion.
It is.
In other words, we don't know what the hell's going on,
Yeah.
and so you must have Meniere's, as opposed to saying, do you have any of these other symptoms? Because if it was all limited, all your symptoms limited to the inner ear, I would probably argue, well, maybe you really do have Meniere's. But once you start throwing in the neck and the headaches and the eye pain and the weeping and there's a lot of moving parts to what you're telling me. And I think our specialists just see myopically. We're all guilty of it. That's how we're trained. But there's a whole other person that's attached
Yeah.
to those symptoms.
Yeah.
Okay. Any questions for me before we get started?
I don't think so.
Okay.
I'm ready.
Let's get rolling.
Okay.
Okay, so you just finished up round one of the DTR therapy. Tell me what you feel. What is different? What do you notice?
My bite feels easier to just put right together, if that makes sense. Before it would kind of like, I could slide it in a few different spots.
Sure.
It comes right together now. Let's see, shoulders are still, they're still tight, but it's not, before it would feel like I'd have to kind of constantly rub back here and give myself a little massage, and I do that throughout the day. But that feels a lot better too. And I don't know, as far as the Meniere symptoms go, I think I'll have to wait that one out and see what happens. Because
Time will tell.
they come and go, you
Yeah.
know, they wax and they wane. Like even driving here this morning, I had not a drop attack, thank God, but just on the road where everything started to shift and move a little bit, and then it passes, and so yeah.
And what's interesting is that TMD has that same phenomenon. Like the symptoms of TMD will wax and wane and get better. So as you move forward with this, we don't know what our result's going to be, but you know, after a week goes by, then 2 weeks, and then it turns into a month, and then we get some time behind us. What I suspect is going to happen is you're still going to have symptoms, but can we make an 8 out of 10 day turn into a 2 out of 10 day?
Yeah.
That's a huge win.
Yeah.
Okay, so you know, Meniere's disease and TMD and trigeminal neuralgia, all of those things, they're never talking in terms of cure. They're talking in terms of treatment. How do we refer to these symptoms? Some of them will go away completely. Some will continue to stay on, but just at a lower intensity, duration, or frequency,
Yeah.
which is still a huge win.
Yeah.
Especially when we're doing this therapy without medication or surgery. Do you have any questions for me about anything?
In your experience with dealing with hearing loss,
Yeah.
How many people get hearing back?
Great question. So I've had a couple of patients instantaneously say, I can hear clear, the stuffiness of the ear is gone, only to have it come back or alternate between ears while things are still settling. Because remember, all these cranial sutures move and all the bones are subject to repositioning, all of them. And we have documented proof of that, not in the DTR setting, but there's other literature that says these are not fixed sutures. And you can't turn the physiology of the body off, so it's constantly trying to develop and get to a good homeostatic position. But I'd say it's about 50-50. So I'm not here next week. We're gonna make an appointment for you for the first week of October.
Okay.
And we'll do the same thing. Now, it's not going to be as intense time-wise.
Okay.
It's going to be an hour in and out.
Okay.
And it probably won't be a full hour because the adjustments, sometimes you might drive down here and here, and we might not make any adjustments.
Okay.
But if you want to use the MLS or the ultrasound to release some of this tension back here,
Yeah.
totally cool with doing that.
Okay.
But we don't adjust if the computer doesn't say there's not a reason.
Okay.
Okay?
Sounds good.
Welcome back.
Thanks. It's been a while.
It's been a little bit. How have things been since last time?
Pretty good. I still have not had any drop attacks since we started, so that's great. I mean, I actually did have a mild one, but that's because I tried to eat pizza. So that
Pizza's no good.
apparently not. I am careful with my diet. Like
Sure.
I have to be careful with, certain things that seem to trigger inflammation for me. And so I was hoping, since I've been feeling good, that I could get away with it, but it brought it all right back. So
Sure.
I had to wait it out for about 2 days, and then it all kind of subsided, and now I know.
Was that, would you consider that pizza to be like a salty intake, maybe?
Salt
Or
doesn't seem to, I don't limit salt.
okay,
I tried limiting salt out the gate when I first got the diagnosis
sure.
for a few months, but it didn't do anything. And so I realized that's not a trigger for me. The triggers are like food groups, like dairy, sugar.
Caffeine?
Big time caffeine, yeah.
Okay.
Yep. So as long as I stay away from those, it seems to be okay. But yeah, I thought.
So the big ones in the literature are, of course, caffeine and salt.
Yeah.
But I really, the more and more I do this, the more it can be really anything.
Yeah.
And it's interesting that what we did to get the bite right had an effect with the drop attacks, because we've been at this a couple of months now.
Yes. I think we started in September.
Yeah, so almost 6 months.
Mm-hmm.
And so is it fair to say that you noticed a difference now versus before we did treatment as far as what your symptoms were?
Yeah, because I was still eating the same prior to treatment. Super careful. I was very strict on my diet,
Sure.
but I was still having the drop attacks, usually about one a month.
Okay.
And I haven't had any since then, except for that one.
The
last
pizza
week
episode.
From the pizza. So,
Okay.
and even that was a mild drop attack. It was pretty mild. So yeah, no, that is fair. I still have tinnitus. The tinnitus is more mild.
Sure.
I told you the last time, I think it was the last time, that I could plug this ear, my good ear,
And hear your husband
and I
on the
could
other.
hear my husband in this side, or hear the radio even.
Sure.
And that's new, because it used to be like I couldn't hear hardly anything. If I heard anything, it would just sound like wah, wah, wah,
Right.
So I can hear, and that, some days I'll plug my ear and I can't, it's kind of back to the wah wah, and then some days I plug my ear and I actually can hear my daughter whispering. So it just depends on the day, but that's still an improvement from hearing nothing.
Of course.
Yeah.
Of course. Well, it's interesting, and it's that. It's like we accept certain fluctuations as being normal. Like, okay, your blood pressure will have a radiation up and down depending on what part of the day it is, and also what you eat,
Yeah.
right? So if you have caffeine on your way in here, you're running late, and you had a hamburger with French fries,
Yeah.
it's going to be elevated,
Yeah.
right? The bite does the same thing. But when you're hardwired for symptomology, and this is most apparent in pain patients, so like the loud noise or the bright light can trigger a migraine. I don't think we really have it figured out what triggers drop attacks
Right.
or vertigo or the tinnitus. We know that it fluctuates and can fluctuate pretty wildly up and down. And our hope is that when we control the trigeminal input for the things that we can have control over, that mechanism gets down regulated. So you're still going to have the peaks and valleys,
Yeah.
but on your bad day is a 4 out of 10, not an 8 out of 10.
Exactly.
Right?
Yeah.
Okay. Is that fair?
Yeah.
Okay. All right. And so by doing that, we can get quality of life back up where you're
Yeah.
doing some of the
Exactly.
things
Yeah.
that you were doing before this whole thing precipitated. Just remind me, was there any one thing that kind of precipitated, okay, from this point forward, I have the drop attacks, but prior to this event, I really didn't have any of the vertigo or the tinnitus or the hearing loss?
Was there anything that like
That stands
started it?
out, that started it. Yeah, what was the initial event or
Pregnancy.
pregnancy? Okay, all right.
And I've heard that a lot. Or I've read it. I haven't heard it. I've read a lot of women say they were pregnant when they first came down with Meniere symptoms.
Okay.
So that's what started it all. And then the drop attacks came years later. I think I'd had Meniere's about 3 years before the drop attack started. Even though I was still eating super clean, on my supplements, then the drop attacks started happening more and more frequently, and that's what scared me.
After today, I'm going to check your bite again and see, because it sounds like things are stable from what you're reporting to me, and I want to just confirm that with our instrumentation.
Yeah.
If they are, I'm probably going to dismiss you. I
Okay.
see another reason for you to drive down 4 hours in the car to have me tell you,
Yeah.
things are okay.
Yeah.
You kind of already know that. But I want to still leave the door open.
Yeah.
If it's 6 months or 6 years that things are good, and all of a sudden you have a massive drop attack, this has changed.
Yeah.
The bite has changed.
Yeah.
And so the body, you can't turn the physiology off, and this is not a door hinge with a door frame. It's constantly remodeling. And since the neurophysiology is sensitive for you, if an interference hits just right, it will trigger it.
Yeah.
Is that fair?
Totally. I kind of wouldn't be surprised if the bite was a little smidge off. I don't eat pizza a lot, just because
Sure.
I don't cheat a lot. But I have had pizza on 2 other occasions when I was feeling really good after treatments and it did nothing. So the fact that it did something this last time kind of made me wonder. I wonder if it's not quite as good as it used to be.
Yeah.
Yeah.
Yeah. And the thing that gets me is, bone being a living tissue and remodeling, it is going to move. The teeth will move throughout life based on the force that is applied to it, and this does a really good job of controlling those forces. But you get a new skeleton every 6 months. That's one of the realities of treating this disease process.
Yeah.
And still, we were able to bring around a positive result with no surgery,
Yep.
no medication, no Botox injections.
Right.
You didn't go deaf in the process.
Right.
So my whole thing is, I want people to just kind of be aware that this is a possibility, and just because a board certified, very smart, credentialed doctor told you X, sometimes you hear prints and it's not horses, it's zebras.
Right.
So if you're doing everything that you're told you should do and you're still not getting relief or at least a diminishment, you could be misdiagnosed.
Yeah.
And I think that happens
A lot. Mm-hmm. I do.
Yeah, just because I'm on the same floor as you are.
Mm-hmm.
Are you glad that you had the treatment done?
Yes.
Okay.
Yeah. Because the thing, vertigo, probably had I done this when I was still having like the rotational vertigo regularly, it probably would have taken care of that as well. And that's a horrible thing. But drop attacks are a different kind of horrible.
Yeah.
Like, I feel like that, there's something really unnerving about that, where it's like, can you drive? Every time you go down a big flight of stairs, you're wondering, like, oh my gosh, if this happened right now, I'd tumble. Or if I'm holding a baby, or
Sure.
if you're living life, you just feel like you can't live it freely, because you have that in the back of your mind, like, I could totally tumble right now. So to have that taken off, it's like, yeah, priceless for me.
Perfect. Well, when you were given the Meniere's diagnosis, what were your options? What did they say?
They didn't tell me anything. They told me you can take the meds that they prescribed as needed for the vertigo. There's no cure and no real treatment that is
Sure.
effective other than severing the nerve. So,
Any risks to severing the nerve?
well, yeah, like you lose your hearing and relearn how to walk with balance and all of that. So it's kind of a big deal. And then they did say that they could try injections in the inner ear.
Gentamicin.
But it also has mixed results too. And so for me, I'm like, well, then I'll go my own road and try things that are a little more natural and less invasive that have mixed results. Just seemed like the no-brainer for me.
Sure. Well, and all things being equal, even if this didn't work,
Exactly.
by getting the bite together, at least we're not going to be breaking teeth.
Yes.
You're not getting any crowns.
Yeah.
It's
At
a
the
benefit
minimum,
to
there's
that
no
too.
consequence. Versus with every treatment option the ENTs offer, there's a consequence that comes along with it. Like, there's a risk. And something that's taken from you, in the
Sure.
process. Something good, whether that's hearing or balance or... So I just didn't want to go that road unless, I would have to be at my wit's end to go that road.